And so I'm now going to invite the administrator for our Office of Public Health, Christina Miller, to the podium to talk about how we are going to go forward as this pandemic changes once again, thankfully in this case, in a good way. Good morning.
Good morning, everyone. Thank you for inviting me here this morning to provide a brief update on where we are in terms of COVID status, as well as an overview of recent and upcoming changes in terms of how we live with the disease. My name is Christina Miller. I'm the administrator for the Office of Public Health, for those that I haven't had an opportunity to meet yet. And Ms. Cofrancisco, I'll ask you to advance through some of these slides, in some cases a little bit rapidly, as we illustrate some of the points here. So next slide. Vaccination remains our primary and best mechanism for preventing severe COVID. So I'll start here. And at this time last year, we were in the very early stages of making COVID vaccines available. And while we haven't seen significant changes in these numbers over the past few weeks, we have seen substantial changes over the past year, of course. 90% of our whole population from Montgomery County and more than 95% of the eligible population of people ages 5 and above have had at least one dose of the vaccine, and the vast majority of those are fully vaccinated. Not reflected here is our booster rate, and many are not yet up to date with a booster, and I encourage those who are eligible to get their booster, or if they have questions, to talk with a healthcare provider. And we continue to offer vaccinations and boosters and have consistently seen phenomenal participation at pop-up events throughout our community over the past several weeks. Next slide. In terms of a status update, for the week ending February 25th, our new cases over the entire week totaled 574. And for comparison purposes, about 6 weeks ago, we were seeing that number or more on a daily basis in terms of new cases. In addition, our hospitalizations continue to decline. And again, by comparison, about 6 weeks ago, we saw more than 600 individuals hospitalized for COVID, and currently we're seeing about 93 people on a daily basis hospitalized with COVID. Next slide, please. So as we are emerging from the Omicron surge, the natural question is COVID endemic now? Are we in endemic phase? And the answer is that we're transitioning towards endemic phase, but we're not quite there yet. And I'd like to take a moment to talk about what endemic means. Endemic doesn't mean that a disease is going away. It doesn't mean that it's harmless or that it's mild. It actually means that it has a consistent presence in a population, and that there's a usual prevalence or a consistent pattern, a predictable pattern within a geographic area. Ask for the next slide. So we've seen somewhat of a predictable pattern in terms of a respiratory illness. During the winter months, we tend to see a little bit of a spike or a large spike, as we did this past winter, in terms of new cases. Next slide, please. But we've also seen spikes in cases outside of that normal seasonal respiratory virus or respiratory illness pattern. Next slide, please. And if we look at just the past 6 months, we've seen the Delta variant, which impacted us in what would be considered outside of a normal respiratory illness season, followed by Omicron, with a significantly higher level of transmissibility than we've previously seen, and that caused significant and widespread disruption for much more than a month. Next slide, please. And while Omicron has shown itself to be less virulent than previous variants, it placed immense pressure on our healthcare system. And even though it was less virulent, because of its high level of transmissibility, we saw more hospitalizations with Omicron than we have with previous variants. Next slide, please. So although COVID will have a presence with us for this foreseeable future, we don't actually know yet what that usual level of COVID will be or how predictably it will behave in the future. And while we may not be ready to say that COVID has reached endemic status, we are shifting our approach to how we live with the disease. As we go forward, this means shifting our approach away from preventing all illness or all transmission of the disease toward preventing severe disease and preventing strain on our hospital. Next slide, please. So why the change? 2 years into this pandemic, we are at a turning point. We have many more tools available to us now than we did 2 years ago. And these are the tools that will allow us to manage how we interact with the virus going forward. Vaccination, again, remains our first line of defense and best strategy for preventing severe illness, and we know that individuals who are up to date with their vaccines are at significantly lower risk for severe illness and death. And when we are feeling sick, testing is now widely available and can inform how we proceed when we are sick. And in addition, when someone does test positive for COVID, we're now able to access medications that can prevent the onset of severe disease. Next slide, please. Accordingly, the CDC recently updated its framework for assessing COVID's presence in communities. The previous framework relied on transmission levels using incidence or new cases per 100,000 of population and the percent of PCR tests that were positive. Those community transmission indicators don't reflect the full scope of transmission because they don't capture at-home tests, and they also can't differentiate between mild and severe disease, and they don't reflect strain on the healthcare system. The CDC's new framework uses a combination of indicators to understand the spread and severity in a community. Incidents using PCR and antigen tests delivered at point of care, again, not at-home tests, can tell us when COVID is on the rise in a community, and new cases, or new COVID admissions, and the percent of staffed inpatient beds occupied by individuals with COVID-19 can tell us how severe the virus is. So to use this framework, we begin with the incidence to determine whether we're looking at the top 2 rows or the bottom 2 rows, and then we use the remaining numbers to determine what category or level we're in. Ask for the next slide. So using our current situation, we are currently at 126 cases per 100,000 of the population, so that's below 200,000. And our new COVID admissions is at approximately 11 per 100,000. Next slide, please. And the percent of staffed inpatient beds occupied by individuals with COVID-19 is at 4.6% or below 10%. Next slide, please. So using the higher of those 2 numbers, we are currently in the medium level of COVID-19 for Montgomery County. Next slide, please. If we saw a spike in hospital admissions, for example, that would tell us something has changed, and that should inform our decision-making about mitigation measures. So if we applied those same hospital level indicators, but we were above 200 cases per 100,000 of the population, we'd be at a high level of transmission. Next slide, please. The CDC's criteria and scientific rationale for selecting the indicators and benchmarks is available on its website. You can Google CDC COVID-19 community levels to find that scientific rationale. But it's important to know that the CDC tested these indicators and benchmarks to see how this framework would have applied in previous surges, and they found that the indicators and benchmarks have strong predictive capability. In other words, they consistently provided an early warning for hospital strain 3 weeks following movement into the high level of transmission. So we know if we're in low, medium, or high, what should that inform? The framework is intended to inform decision-making at individual or family levels in specific settings like schools, workplaces, congregate care settings, and community mitigation strategies like increasing or decreasing testing availability or access to vaccination. Next slide, please. So notably, masking is recommended during high levels of COVID spread and severity for individuals who are not at high risk for illness, and that's a shift away from the previous framework that recommended masking at substantial and high levels of transmission. Next slide, please. Now, those who are at high risk for severe illness or who may be caregivers for others who are should talk with their healthcare provider about their risk and the mitigation strategies that are right for them at medium and lower levels. And in terms of recommendations within specific settings or across the community, schools, workplaces, and other settings can use this time to begin to understand and discuss what mitigation strategies might be right for them at different levels and inform their constituent groups about those updated strategies so that everyone is prepared and informed as we move between levels. Next slide, please. So where to find this information? The county COVID level can be found at the CDC's website, and beginning tomorrow, Montgomery County's COVID-19 Data Hub will feature the data that's guiding the determination of community level. In addition, we'll be featuring the 3 data points relevant to the CDC's framework right at the top of the page, and we'll use some additional community context, including ICU bed utilization, ventilator utilization, and loss of life to explain the local context. In addition, the resources and supports that our team has offered directly in communities through testing and vaccination, homebound vaccination, and on-site support for some of our higher risk settings will not go away. These resources and supports will evolve as COVID's presence and our community's needs evolve. We'll continue to make testing available, and we can expand and contract our capacity as COVID levels and testing needs shift. And over the coming months, we'll begin to integrate COVID vaccination into our routine operations and continue to partner with our community partners to ensure that all of those who need access to the vaccine have it. Should vaccinations become available for our youngest residents, we plan to make that available just as we did when vaccinations became available for children ages 5 to 11. We know that our pharmacies, which have provided vaccination for thousands of residents and children, are not at this time able to offer vaccinations to those under 3. Last slide. So much of what we've been able to accomplish in the past 2 years has been through the power and connection of our entire community: healthcare providers, pharmacies, first responders, schools, essential workers, faith communities, community coalitions, and volunteers, people that showed up every single day for our community. As we transition into this next phase of living with COVID, these connections will continue to be absolutely critical to how we move forward. We'll continue to have COVID-related needs, and we can show up for one another in other ways as well. Many of our neighbors are beginning or already have resumed some of the activities that they may have paused during the past 2 years, and they can feel confident doing that because they are up to date on their vaccine or they're at lower risk for severe COVID. Neighbors who may be at higher risk for severe COVID may be immune compromised or care for someone who is may continue to be cautious. We can be mindful that COVID has impacted all of us in different ways, and it will continue to impact all of us in different ways in the days ahead. Thank you for the opportunity to offer this overview and summary today, and we'll look forward to continuing to serve our community as we move forward. Thank you.
Ms. Miller, thank you so much. It was a great synopsis and update of how we go forward. And I just want to underscore a couple things that you said. One, that this represents a shift in philosophy with COVID-19, that rather than preventing transmission of disease, which has been the focus of the last 2 years, now that we have vaccinations and plenty of testing and treatments available that didn't exist previously, now the focus will be on preventing severe disease, understanding that there will be some transmission of COVID in our communities, but if people protect themselves with vaccinations and they take advantage of treatments that are available, that should limit severe disease. And so I think this is a evidence-based, data-driven approach to a shift based on where we are now compared to where we were 2 years ago. And so the county will continue to make sure that our constituents have access to all of those metrics that they need to understand where we stand as a county at any given time. We will continue to operate and offer testing to our community as well as vaccinations. And I've been very pleased that our community-based vaccination efforts continue to be very well utilized. There was one last weekend where 154 people came to get vaccinated, many of them to get their very first dose. So I continue to encourage individuals to take advantage of these free, no-cost vaccines. We're trying to make it as easy as possible for people to remain vaccinated or to get vaccinated and then to stay current with their vaccines. And I just want to thank all the folks in our Office of Public Health and so many other county employees who've assisted the Office of Public Health in this work over these last couple of years. It has been an incredibly difficult and time-consuming and unprecedented response to a disease that nobody had seen before until 2 years ago. And just want to thank you for efforts past and ongoing. Thank you.
Ms. Miller, thank you for the report. It's been a long 2 years. The Office of Public Health has been there from day one, around the clock. You actually came into it during, which I questioned, but and you provided steady leadership in council, and we look forward to moving into this next endemic phase. Thank you.
Thank you for the update, Ms. Miller.